Dr. Jen, and this is your specialty,
Yeah.
OBGYN. We're looking at a shortage.
Yeah, this was a headline that got my attention. There's an estimate. Well, first of all, right now, there's already a shortage of board-certified practicing OBGYNs. There are about 50,000 in the country. That's data from 2018. That is way fewer than are needed. We're really considered the primary care physicians for women with specialized surgical training, of course. But guess what? It's about to get a lot worse. By 2030, there is estimated there will be a further shortage down by 5,000. So 5,000 fewer OBGYNs at that time. And I think that right now the theories in terms of reasons for this are, obviously the big one, the big headline in the last 2 years is legislation, and doctors in certain states quite literally risking prison time. Not just losing their license, but jail time for providing care to women that we've been trained to do. But then aging workforce, a lot of doctors over the age of 55 who are, maybe thinking about retiring, being forced to kind of consider that sooner rather than later because of everything that goes on. And then anyone in healthcare knows that right now, if you divide up the time in a pie chart of what we spend our day doing when we're talking about seeing patients, a small part of it, unfortunately, is clinical direct patient care. A huge part of it is paperwork, forms, low reimbursement from insurance companies where doctors quite literally can't afford to continue practicing. This is going to be a massive problem, and it's also occurring in Europe, by the way.
So how do we change this for the better? I mean, you think about rural areas like the Mississippi Delta, sometimes they have to drive like an hour or two to Jackson.
There's no one in the county.
I mean, it's a complicated issue, and I'll work on it in my spare time.
All right, we hope so.